question, member from Oshawa.
Thank you, Speaker. And my question is to the Acting Premier. Speaker, in Oshawa, there are more people waiting for long-term care beds than there are existing beds. And that's why my constituents, Mary Ann Fallist and Stephen Hoare, came to my office in a state of hopelessness. Their mother, Anna, was sent to the hospital by her retirement home in early February, a home that could no longer meet her needs. After she received emergency hospital care, there was nowhere to send her. Anna is in limbo, waiting in the ALC, or alternate level of care unit in the hospital. Her family has no idea when or if she will be able to leave. There is nowhere for her to go. This government has allowed long-term care waitlists to balloon to a crisis state. When will this government take responsibility for the long-term care crisis and start helping families like Anna's get the care that they deserve?
Thank you. Acting Premier.
The Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Thank you so much, Mr. Speaker. And of course, we have been addressing the issue that the member opposite is referencing. In fact, just recently, we have announced the opening of 5,000 new long-term care beds over the next 4 years, as well as providing more than 15 million more hours of nursing, personal support and therapeutic care annually for residents in long-term care homes. This is part of our 10-year plan. You know, Mr. Speaker, we are really into long-term planning. This is a stark contrast, obviously, to the third party. We've never heard of any plan on their part to increase long-term care beds. So our 10-year plan is to create more than 30,000 new beds over the next decade, and we're continuing to work with the long-term care sector to determine exactly where those beds should be placed in our province. Thank you, Mr. Speaker.
Supplementary.
Thank you, Speaker. This government has had 15 years to help seniors and families get the care they deserve, and instead of a long-term care plan, they have a long-term storage solution. And if they truly cared, they would have already fixed the wait lists. Instead, they have only made them worse. Liberal cuts and privatization, much like what we would see from Doug Ford and the Conservatives, have left Anna's family in an impossible situation. Her family is being told that if they want to get Anna into appropriate care before the end of the year, they would have to start looking far outside their community. While she has been in the hospital, Anna has fallen, she's gone without any showers, and she's watched her hospital roommate and other forgotten seniors die while waiting for a space in long-term care. Anna's family is terrified, Speaker, that she is also going to die in the hospital waiting in ALC, which is serving as long-term storage, not long-term care. How does this government justify years of gutting our healthcare system while families have nowhere to turn and seniors like Anna have nowhere to go?
Thank you, Minister.
Well, Mr. Speaker, the member opposite perhaps just needs to be reminded of our throne speech earlier this week, wherein we talked about all the investments our government has made over the course of our being in government over the last 15 years, specifically for the vulnerable population that she is.
Finish, please.
Well, thank you, Mr. Speaker. And of course, long-term care homes are part of the picture. But our investments through the years in home care have been absolutely phenomenal, in my view. Since 2013, our government has increased funding for home and community care to help those frail elderly stay where they would wish to stay for as long as possible in their own homes by some $250 million per year. So this is in addition to the government's ongoing funding of more than $5 billion. Of course, our announcement... Thank you, Mr. Speaker.